For a lot of big events over the holiday weekend, and now we're joined by Dr. Jeffrey Potoff from UW Health. And Dr. Potoff, so the events that we're talking about, Summerfest, the first Badger home game, obviously Labor Day weekend, could we see a spike in cases? And if so, when would that happen?
Yeah, so we could see a spike in cases. Even though a lot of the events that we partook in over the holiday weekend were outdoors, many of them were with people in very close proximity, and we do know that transmission can happen. Now, it'll take a few days for those folks who were exposed to develop symptoms, somewhere in the range of 3 to 5 days. Usually it's a couple days after that they finally get tested. So usually between 7 and 10 days, we'd start to see numbers increase if something happened over this holiday weekend.
All right, so that's something that we'll definitely keep an eye on. And also, I wanted to ask you today about the Mu variant. It seems like we just started to report on it, but what information do we have right now that we can share with our viewers?
Right now, this is just a variant that we're keeping our eye on. When we look at its molecular structure, it does have some features that should make it better able to escape our vaccinations. With that said, we're not seeing it spread nearly as effectively as, say, Delta variant. But, as we saw with Delta, sometimes when these things get going, they can go fast. So right now, it's a variant of interest. We're keeping an eye on it. But I wouldn't be too worried about it at this point in the game. It still looks like Delta is the main threat that we have.
And speaking of the Mu variant, I wanted to touch base on the latest booster information that we do have. Could this be, a possible way to perhaps protect ourselves from new variants to come?
I think boosters are a good way to protect us, whether it's from Mu or whether it's from Delta. We know that when we get booster doses, that those antibody levels significantly increase, which gives our body a better chance of combating a variant that's even a little more better at beating those vaccines. So certainly not a bad idea to get boosters once we learn more about timing for those in the near future.
So there's no set deadline right now, or at least date where you're like, okay, this is when you should go get a booster shot. We're still waiting on more information.
Correct. I think the date that's out there is September 20th, but that was with a caveat that the FDA and CDC would need to look at all that available data. I know that they're doing that, so I expect that we'll see some sort of announcement yet this month, but whether it holds right on September 20th or not, that remains to be seen.
Okay, and last question I have for you before we let you go. Ivermectin, this is a conversation that we've been having a lot the last couple of weeks here. This is a dewormer for livestock. It has been used for humans, but there is no evidence that this is proven to treat COVID. Is that correct?
There was some evidence early on the pandemic that some argued that maybe it helps. There's other studies that said probably doesn't. But what's happened over the months is that the data on the pro side, 2 of those studies were withdrawn. And now we have a fairly robust evidence base that suggests that it's not helpful. So even though it would be great to have a cheap anti-parasitic help with COVID, we're still left with vaccination, which is great, but other emergency use approved medications like monoclonal antibodies that are much more effective against COVID than ivermectin if you're to come down with it.
All right, so just pay attention to that research and make sure that you know what you're intaking before you do so. Dr. Jeffrey Potoff, thank you so much for joining us.